For many patients who are seeking our services and dealing with lumbar spine pain and dysfunction, traction can be a valuable resource or interventional tool that we go towards to provide alleviation of their symptoms and to decrease the irritability. Now, there are a number of ways in which to provide traction. It can be provided mechanically, it can be provided manually, and it can be provided towards an extension bias or a flexion bias. Today, though, I want to show you just one or two very easy traction variables and progressions that you may choose to utilize in your clinical practice. To begin with, let's focus on more of a flexion bias traction. And so we're going to ask the individual to bend both knees up. Great. And for an individual that is going to begin in a hook-lying position, this is going to facilitate a little bit of a posterior pelvic tilt. Now, we think, okay, who might this intervention benefit? Well, this is for your individuals who are dealing with some stenotic features, possibly dealing with irritability due to facet arthropathy, a spondylosis or spondyloaropathy, something along those lines. And so for these patients, this can be a nice way to create a little bit of space and decrease the irritability through the lower back. From this point, you can stabilize both feet by bringing them together and just sitting on them. And then you can either, using your hands manually, kind of grab here and lean back and provide a little bit of that traction just like that. Or you can also take and put a gait belt right through kind of the superior portion of the calf, the gastroc, wrapping it around your trunk, and then all you would need to do is just kind of lean back. You'll notice as we do this that there's a little bit of cervical flexion that occurs. There's a little bit of a chin nod. And the reason for that is we know that we're providing a nice distraction force with that pull. The second option would be to leave whichever side up that we want. Let's say this individual, hypothetically speaking, is dealing with lumbar pain and it seems to manifest a little bit more on his right side. In this case, we can leave that left side up. We can ask him to relax the right side down. Now at this point, many individuals appreciate just a little bit of a pull. And again, you'll notice by kind of bringing my hands in, interlocking them and wrapping them around the malleoli, both medial and lateral, I can create a little bit of a pull. Watch the head and neck. As we pull, there's a little bit more flexion. We're distracting right on this right side. Now at this point, we can also provide a little bit of an oscillation. And that oscillation can help the patient to begin to relax. If there's muscle guarding or anything along those lines, that can be beneficial, and you can begin to work into some different quadrants. You can work into more of an open pack position, which is more abduction, external rotation at the hip. You can even work across and open up kind of that lateral right posterolateral spine kind of through the QL region. And many times, patients will report alleviations of their symptoms. You can let off some of the tension and then you can lean back as you're providing this. So it can also be similar to an intermittent traction technique as well. The optimal beat frequency here is variable, though you're going to want to be somewhere between about 120 to 150 beats per minute. Anything less than that, where it's a slower beat frequency, the patient's more likely to guard at this level, but if you can make it quick as well as relaxing, oftentimes the patient will allow those muscles an opportunity to relax, and then from there you can move into some of your other techniques, manual related or other exercise and interventional techniques. So two quick ways in which to provide traction. There are other ways in which you can provide gait belts around the ASIS, again to facilitate flexion versus extension, or utilizing mechanical traction table. However, have a go with these two and let me know if there's any questions.